With 14 more cases of the COVID-19 virus announced, bringing the total of confirmed cases in the country to 172, more stringent measures by government are slowly taking shape. According to the Health Cabinet Secretary Mutahi Kagwe, 12 of the new patients were Kenyans and 2 were foreigners. 4 patients among the 12 had a history of travel, 4 had been quarantined, and 10 picked up following surveillance. The 14 were among 696 people tested in the last 24 hours.
Let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us.
Health practitioners, Mutahi says, will also undergo testing to avoid infected medics from coming into contact with patients. According to the Ministry of Health Director General Dr. Patrick Amoth, 1 person is in critical condition but out of danger. He equally noted majority of the cases are mild, with the youngest so far being 2 years old and the oldest 72 years.
Our case fatality rate has been about 2 to 3%, which compares very, very favorably with other countries. In the early stages of the infection, in which case you are dealing with smaller numbers, and therefore the accrued death rate or the case fatality rate tends to be low.
The CS further noted that 3 people have been discharged in the last 24 hours after they recovered from the COVID-19, bringing the total number of recoveries in the country to 7 and 6 confirmed fatalities.
We must brace ourselves, mentally be prepared to face a situation that we haven't faced before. But I also know another thing. I know that we will pull through.
On Wednesday, President Uhuru Kenyatta restricted movement into and out of 4 affected counties, that is Nairobi, Mombasa, Kilifi and Kwale, for 3 weeks. CS Kagwe said the president's announcement was partly informed by a case of the virus reported in Mandera of a person who had traveled from Mombasa. He also reiterated that inter-county movement is discouraged. Diana Rose, Switch TV.